Of the many conversations that I have had with Odile Block where she has left me literally stupefied, the one that had me standing there in greatest slack-jawed awe was one statistic that she gave me about the level of waste of one particular product in our hospitals, because the EPA had audited hospitals as to the use of a number of different food products, but it was salt and pepper sachets in particular that got me. The problem being, you hand a patient with a tray with a salt and pepper sachet on it and they don't use them, they have to be thrown out because they have crossed this sanitary line by beyond which food cannot be recycled or reused. It has to be thrown out. The cost annually to the country of fecking salt and pepper sachets that are not consumed is €600,000. And that is one of the things that, through very simple little measures like saying, would you like salt and pepper with your dinner or not, that the HSE is addressing that kind of wastage. We have two people who can speak directly to that now from Connolly Hospital, Blanchardstown, Maurice Friel and Carl Dalton. Who's speaking first? Carl, you speaking first? Or okay, come on up. Maurice Friel, Carl Dalton.
Even offer salt to stroke patients as well in the hospital as well. Where Suzanne kept you all awake after the break, I'll have you asleep in 2 minutes. But I will only speak for 2 minutes because I'll hand you over to Maurice Friel specifically to talk about the food waste programme. I just want to paint a bit of a backdrop first to what our programme is part of. There's a Hippocratic oath that's in healthcare. First, do no harm. The problem with healthcare settings is do no harm applies to the patient, and that's where they stop. They don't realise that a healthcare entity has an impact way beyond its front gate. And you can see that in so many of the ways they operate, as Philip mentioned there, in the way that we use our energy, in the way that we actually run our whole service. For many years, a small group of us within the health service, myself and Connolly Hospital, have been pushing very hard the sustainability programme. And eventually, in the last year, the Director General, Tony O'Brien, has put sustainability as part of the business model for the HSE in the future. We are a pilot site for sustainability, and the brand name that we've put on on our programme is Cambio. It's a simple name. It's the Spanish for change, and the bio bit means life. So change life, change the way we run our lives. We have many initiatives in that. It's to do with retrofitting for our energy, behavioural change in the way that we use energy. In our food programme, which has been greatly assisted by Mairead and the others at the Clean Technology Centre and gratefully funded by the EPA. But we must continuously, in all aspects of our business, look at what happens beyond our gate. If we look at the world at this current moment in time, you can see that the classic countries are the ones where we have the population malnourished. And as you can see here, this is the dietary energy consumption. This is the energy consumption that people get in their diet that they need to survive from day to day, as in the classic sub-Saharan parts of the world. Yet we produce enough food to produce or to feed the world over. We still have poverty in these regions. And you mentioned about supermarkets. You'll see in the supermarkets things like Mange 2 or green beans. These are flown from countries in Central America and South and Sub-Saharan Africa. So these people cannot survive. They cannot get enough food for themselves, yet we're not going for seasonal veg. We're bringing stuff from around the world. It's as if man's subconscious mantra for the action, for his decisions in purchasing, is the reason why I do something is because I can. There doesn't seem to be any consideration or responsibility taken by modern man in the West. There's a bigger consequence which will come home to ourselves. And again, in healthcare, we have to consider this, the first do no harm. we are going to do harm to ourselves in our own countries, in our own Western civilization, by exceeding the number of planet requirements that we have. If you see in the graph here, around about 25 years ago, we went over the number of planets that we are using. And that's going to catch up on us. We're going to see a prevalence of droughts. We're going to see a shortage of natural resources. We're going to have more diseases, becoming more mobile around the world. You can see the Ebola crisis, because we didn't address poverty in the world, because we are happy to extract from these countries without having a proper social responsibility towards them. They are left to reap the problem. And the only reason why we're doing something about these things from a health perspective is because we're frightened it's going to visit us. So, on that note, I'll pass you over to my colleague, Maurice Friel, who'll go through what the food waste program is in Connolly Hospital. Maurice, thanks.
Thank you. My remit within the hospital is General Service Manager, so the catering department comes under my remit. So I've been working with Carol and Marie Creedon from the Clean Technology Centre in relation to our food waste. So in relation to the food in the hospital, we believe nourishment is at the heart of healing and plays a vital role in the healing process. It's estimated nationally that 300,000 tonnes of food waste generated in the healthcare facility per premium or per annum. The majority of this waste is potentially avoidable food waste, plate waste and unserved food, etc. Potential costs of 5 million per annum. The healthcare facilities will always generate food waste. Patients discharged and admitted on a continuous basis. Meal may be ordered in the morning with no patient in the bed at tea. The patient in the bed may not be able to eat the meal ordered by the previous patient, which may have been on a special diet, or they may simply not like the food. Patients may be sent for a scan or procedure at short notice during mealtime, and the meal order is wasted. And lastly, patients don't feel well enough to just eat their food. In 2014, Connolly Hospital was selected as a sustainable hospital site by the National Health Sustainability Office. It was funded by the Green Care Health Programme and provided assistance in waste prevention programme. The aim was to improve sustainability on site, which we had a particular emphasis on food waste and communicated results to other hospitals to encourage food waste prevention elsewhere. Just recently in October and November, we have reduced our food waste to 5.8 tonnes, which represents a 27% reduction compared to September of last year, which is quite significant. How did we achieve this reduction? We focused on three main factors involved in the provision of food and enabling consumption. Firstly, the quantity of food provided to the wards by the kitchen. Secondly, the foods ordered by the wards. And thirdly, the environment in which the patients were eating their food. Firstly, the quantity of food provided by the kitchen. We engaged, communicated and educated our staff firstly. Food waste surveys are undertaken by identified quantities of food unserved and excess of food provided. The hospital needed to ensure enough food is provided to the patients, but recognised that providing too much food generated food waste. A balance had to be achieved. Nutritional dietetic guidelines were assessed to determine the quantity of each type of food that is required by the patients. The quantity of food provided by the kitchen continued. So we took a sample and scaled it a number of patients in the ward, for example 20 patients. We worked out the quantity that was required per patient, and what was provided was greater than what was needed. The total food actually provided for 20 patients. So we then looked at how the food left the kitchen. So more accurate quantity of food was now provided. We purchased new and smaller, shallower containers, easy for the chefs to fill. And we double-checked the number of meals ordered by the wards versus patients present, and adjusted numbers of meals it provides. The food ordered by the wards, essentially that the ward staff ordered the right number of portions for each meal. Two key steps that ward staff undertook in determining the correct numbers of meals to be ordered. Firstly, it was to ask the patient what meal they would like ahead of the meal. This wasn't always being done. And secondly, to consult with the medical staff or patient information boards in each ward to determine which patients are likely to be absent for meals and take account of this when we were ordering. The food ordered by the wards. How does the catering department ensure steps are undertaken? Training sessions were provided for all the catering staff. These sessions outlined to staff why recent changes had been made, improved dietetic intake and reduced wastage. In training we covered the following points: the importance of 2 ordering steps, confirmed that enough food is being provided to the wards. Reduction is food that has been just wasted. Remind the staff that if extra food is needed, it can be easily ordered from the kitchen and delivered within a very short period of time. And we outlined that orders are double checked by the main kitchen, so no over ordering occurred. Greater presence of ward supervision and managers on wards. The environment in which a patient eats has a big impact on the quantity of food a patient eats. Food must be appealing with the portion size not too large. Patients can be turned off, particularly elderly patients, by having too much food placed in front of them. Patients must be fully aware of what food is on offer so they can order the food that they would like to eat. And patients must also be allowed to eat and not be disturbed by visitors or medical staff where possible. Patients must be provided with assistance also when this is required. A protected meal policy is currently in place in some wards. The rollout across the hospital is being investigated at present, and we will develop this over the coming months. The portion size, everyone eats with their eyes. New utensils, plates and guidance provided to allow staff to provide a well-presented plate of food. We are also developing a new menu for our patients as well, so this will involve a new, clear, graphically designed weekly menu which will be provided for each patient at the patient locker, especially useful for older patients or special diets who may require guidance from family or visitors, as the menu can be viewed at any time. We had guidance documents from the Green Healthcare Programme. That's it. Yeah. Yeah, that's.